Nursing research and evidence-based practice. The role of the nurse as a follower, manager, and leader of a healthcare organization in applying research to practice is defined in the context of 21st century demands for providing healthcare based on the best available scientific evidence. So, what is nursing research? Well, the definition indicates that it's a systematic inquiry or study that's conducted to generate new knowledge or to refine existing knowledge. Results provide foundation for practice decisions and behaviors. Results create strong scientific base for nursing. Results provide support for the quality and cost effectiveness of interventions. The application of results demonstrates professional accountability to insurers and healthcare consumers. And nursing research generates knowledge in areas that indirectly affect nursing care processes. So let's discuss a little bit about the evolution of nursing research. Nursing research began with Florence Nightingale, especially during the Crimean War. During this time period, nursing research wasn't considered important. Florence Nightingale made a comprehensive statistical study of sanitation. Then research focus in the 1900s to the 1940s was based upon nursing education, student characteristics, and student satisfaction. Then research focus from the 50s to the 70s was about teaching, administration, and curriculum issues. In the 1980s, research focus was more about qualified researchers. There was widespread availability of computers for data collection and analysis, and then we had a lot of qualitative studies. During the 1990s, healthcare delivery issues such as cost, quality, and access was a focus. And as we go into the 21st century, the focus is based upon evidence-based for practice. Increasingly, research findings are being used as the basis for clinical decisions. Evidence-based practice can be defined as the process of systematically finding, appraising, and using research findings as a basis for making decisions about patient care. Let's talk about the NINR research foci. The National Institute of Nursing Research supports research on the biologic and behavioral aspects of critical health problems that confront the nation. The NINR provides a basic roadmap to channel scientific results to enhance the health of all people. These areas are health promotion and disease prevention, quality of life, health disparities, and the area of end of life. These areas of research emphasized published by the NINR are useful guides for investigators that are developing proposals, but they are not considered to be the stringent in nature. So research, it's a process that takes place in a series of steps. First, you want to formulate the research question or problem. Define the purpose of this study. Review any related literature. At this point, you're going to formulate a hypothesis and define any variables. Then you choose a research design. Select your population, your sample, and your setting. Then you're going to conduct a pilot study. You're going to begin collecting the data. Then, of course, you're going to analyze this data that you've collected. And then we're going to communicate the conclusion. So let's talk about some study designs. These are plans that tell a researcher how the data is to be collected, and then from whom the data is going to be collected, and how the data will be analyzed to answer specific research questions. These designs are often referred to as quantitative, qualitative, triangulation, and pilot studies. As we go through this lesson, we're going to discuss quantitative and qualitative in detail. Triangulation is the use of qualitative and quantitative methods. Pilot studies are small-scale studies that are often preliminary research studies and typically include participants who are similar to those who will be used in the larger research study. Now we're going to proceed to discuss quantitative and qualitative designs. Quantitative designs or studies are a statistical analysis of numerical data that's obtained from samples and populations. These studies usually produce knowledge about very precise topics, creating a need for multiple studies over multiple years before conclusive knowledge is resulted. So let's review the most common quantitative designs used in healthcare. We have the case study. This provides an in-depth analysis of a single subject, group, institution, or social unit. We have the survey. This is used to collect large amounts of information with little expenditure of time and money. Then we have the needs assessment. This determines what is most beneficial to an aggregate group. Then we have methodologic. This focuses on development and testing instruments to improve the reliability and validity. We have meta-analysis. That's an advanced process by which research on a specific topic is reviewed, and then the findings of multiple studies are statistically analyzed and expressed quantitatively. There is experimental. These are studies that include the manipulation of one or more independent variables, random assignment to a control or treatment group, and then observation of the outcome or effect that is presumably the result of the independent variable. Then we have the quasi-experimental. This lacks one of the components of experimental design. For an example, we have randomization, control group, or manipulation of one or more of the variables. Then we have secondary analysis. This involves asking new questions on data that's collected previously. The data may have been generated from previous formal research or may have been gathered through any previous systematic collection of data. Then we have triangulation. This is a use of various research methods or data collection techniques in the same study. And we also have pilot studies. These are small-scale studies referred to as feasibility studies, and the purpose is to identify strengths and limitations of larger planned study. Remember earlier I had discussed the pilot studies and triangulation. Okay, now let's look at the qualitative design. This is a method of research that's designed for discovery rather than for verification. The main technique used is interviewing in this type of design. The main types of research are phenomenology. This is a method used to study intangible experiences such as grief, hope, or risk-taking. Those are just a few examples. It is designed to provide an understanding of the patient's lived experience. We also have ethnography. This is a method used to study phenomena from a cultural perspective. And then we have grounded theory. This is a method designed to explore a social process. Individual nurses may apply research findings to their own practice. However, nurses have a broader responsibility to society that includes activating the change process in translating research into practice. So what do we use research for? There is an extensive concern that nurses have failed to realize the potential for using research findings as a basis for making decisions and developing interventions. Research use can be in a variety of forms: enlightenment, implementation of a research-based protocol, or the widespread adoption of standards based on research findings. They're all all types of ways that we can incorporate research. So let's think about, where do you get your research? Well, with the growth of large databases, the use of electronic health records and sophisticated statistical techniques, examining practices in real-world situations and comparing the effectiveness of interventions is enhanced. Locating published research, focus on the usefulness of computerized databases such as CINAHL and Medline in the annual review of nursing research. Then once you choose your research, make sure that you have a critical appraisal of the nursing research. We have such things such as the blind review, and then of course abstract and findings that may be the easiest sections of a research report for the novice to actually understand. Nurses at all levels of educational preparation should critically read research journal articles and research summary articles before using them. So when you talk about using research into evidence base, there are different types and levels of evidence that you would actually review. Evidence exists in many forms, and so a few of these that we're going to mention are a journal article describing a single study, systematic review methods such as meta-analysis and metasynthesis, intervention guidelines, patient values and preferences, expert opinion. Then there is theory-based information, and of course compiled databases. Okay, remember earlier I talked about critical appraisal of nursing research such as the blind review, abstract, and findings. These articles are accepted on a competitive basis and are peer-reviewed. Some of these examples of evidence-based practice based on the critical appraisals, even though much work remains to be done, the potential effect of research on healthcare knowledge and practice can actually be demonstrated by some. Such of these examples are heparinized versus saline for flushing peripheral intravenous catheters. Interventions such as exercise for cancer-related fatigue. Prevention and treatment of pressure ulcers. Clinical practice guidelines that are developed by the Agency for Healthcare Policy and Research in 1992. Some examples of their research are acute pain care management in infants, children, and adolescents, prediction and prevention of pressure ulcers in adults, and identification and treatment of urinary incontinence in adults. These are just a few of the examples of evidence-based practice based upon research. When you're talking about research, you cannot eliminate ethical issues. It is important to make sure through any research study that human subjects' ethical rights are protected. The Institutional Review Board or the Human Subjects Committee are required by institutions that are receiving federal funding to examine research proposals prior to allowing any research to occur to make sure that no human subjects' ethical rights are infringed upon. There are historical examples of unethical research. Can you think of anything off the top of your head? Well, remember in history we had the Nazi experiments, the Tuskegee syphilis study, and the Jewish chronic disease hospital that was done in New York City. So now let's summarize. Educators must prepare students to appreciate and conduct research and evaluation at their level of preparation. Healthcare administrators must foster research. Consumers must be educated about the value of nursing research. And policymakers must be informed about the findings so results can be translated into healthcare policy. This concludes the lesson on nursing research and evidence-based practice. If you have any questions related to course content, contact the instructor.